Hello and welcome to the Legislative Report. I'm State Representative Doyle Heffley of the 122nd District in Carbon County. The House Human Service Committee handles legislation that affects both the Department of Public Welfare and the new Department of Drug and Alcohol Programs. These are bills that may affect the physically and intellectually disabled, those with special needs, or those struggling with addiction issues. I've been appointed to serve on this committee for the next 2 years, and on today's program, I'm pleased to welcome as my guest Chairman Gene DiGirolamo from Bucks County. Chairman, welcome to the program.
Doyle, good to be with you.
Thank you for joining us today. As we take on the upcoming session, as the chairman of the committee, what are some of the major legislative pushes or the goals that you have set for the committee in this upcoming session?
And as you stated, this Human Service Committee, I mean, I think it's a critically important issue, a committee up here in Harrisburg. We deal with issues with the intellectual disabilities, people with mental health issues, people with drug and alcohol issues. And as far as the issues go, I mean, we recently, just with our first committee hearing recently, we just moved 2 bills out of the committee. One of the bills we've actually been working on, we worked together last session, is this idea of a prescription drug database bill. And the prescription drug problem, as you know, I come from Bucks County, and I know you're from Carbon County, but all across the state of Pennsylvania, we have what I would call a critical prescription drug problem. It's just epidemic proportions in all the age groups, and we're really trying to get a handle on trying to help these people. And what this database will do, when we move the bill out of committee, we'll create a database where doctors and prescribers, psychiatrists, nurse practitioners who prescribe these addictive medications will be able to go on the computer, and the pharmacists also, will be able to go on the computer and see if their patients have been doctor shopping or pharmacy shopping. So the pharmacist will have the responsibility for entering the information into the database, and then the doctors, when they see a new patient and they suspect that this person might be addicted or doctor shopping, will be able to go on the computer and see if this person had gotten these addictive medications somewhere else. So, I commend you on your hard work. I know we worked on this legislation last session, and to get it out so early in the session again this year. I think one of the things that we're looking to do, that I'm looking to do, is obviously bring awareness to the problem. I think a lot of people are not aware of the dangers of some of these prescription drugs and how the addictive tendencies. Some of these prescription drugs are equal to street heroin. So I think obviously there's a need for these drugs if you look at some of the issues with cancer treatments and other things. But I think a lot of times parents are not aware of some of the things that their children are taking or what's being prescribed. And I know there's been several instances in my district, and I'm sure in yours, where addiction issues have come about through an innocent of an injury and then being caused. And it, like you said, it does affect all levels. One of the concerns that some of the members had raised was the privacy, and I know there are a lot of steps taken in drafting this legislation to address privacy concerns. And if you could explain a little bit as far as law enforcement, why they do have a role to play in these types of investigations. What would be the standard if law enforcement was going to be addressing an issue? Great question, Doyle. And confidentiality is very, very important when it comes to this database. And we brought all the entities that have a stake in this, and law enforcement does have a stake in this because they need to have some type of access to this database. Now, the Attorney General is the only one in law enforcement that will have access. So if the district attorneys or the local police want access to this database, they'll have to go through the Attorney General's office. The Attorney General already has a Schedule II database. Now, our bill encompasses all the addictive medications, which are Schedule II, 3, 4, and 5. Our bill puts this database not in the Attorney General's office, but in our new Department of Drug and Alcohol Programs. And I think that gave a lot of comfort to the doctors and prescribers and some of the people that were a little bit worried about law enforcement having too much access. But we came up and we've cobbled together an agreement, I think, between the prescribers, the pharmacists, and law enforcement, where we say that the Attorney General will only be able to get into the database when they have an active investigation going on. In other words, they're not going to be able to just go in and out whenever they want to. They're going to have a reason and an active investigation, and we define that active investigation, what that means. And it's simply pretty much what about 30 other states have already done when it comes to privacy issues and confidentiality. So I think we've got an agreement worked out. I know some people aren't entirely happy with this, but we really worked on this really, really hard. And as you heard in committee yesterday, there still were some concerns, but I think we've got something that'll work, and we've got a good compromise together. So I'm pretty happy with it.
I think what the objective of the bill is obviously to identify those people that are having addiction issues and to try to keep these controlled substances off the street. Obviously, there's been cases where people have investigations using the current system of monitoring controlled substances where people have gone to jail for overprescribing or for receiving. I know in talking with my pharmacists in the district, they're very supportive of this, and they've come up to me, approached me, and said that they need this tool. I think doctors need it. I talked to the folks that are working in the ER that are seeing these young people coming in. But one of the things that this will do is really take that availability of these drugs off the streets. And I think and that's one of the things that, in putting together a program in the district on, we'll be holding a drug awareness expo, drug and alcohol awareness expo at the Lehighton Area High School on April 18th. And we'll have providers from across the state and guest speakers from across the state to address one of those issues with prescription drugs, the availability on the streets, but also advising people that had these prescriptions, maybe they have them in their medicine cabinet, to get rid of them. And a lot of times people are getting 30 tablets in a prescription when maybe they only need 2 or 3 after surgery, and to dispose of those medicines and not keep them around the house with the dangerous tendencies and addictiveness of these. I think that's one of the issues that we really want to bring awareness to.
Yeah, the great message for parents is that the new drug dealer in town is your medicine cabinet at home. Because as you say, you get a prescription for 30 oxycodone or Oxycontin or Xanax or whatever, and you only take a few and you put it in the medicine cabinet. You got teenagers at home, that's a big problem. You ought to make sure that they're secure and not available for your kids to get at. That's the new drug dealer in town, is your own medicine cabinet, unfortunately.
And I think one of the fascinating things in talking with, sometimes talking with people, and they say, well, the kids of these are the current generation of young people, maybe they don't, their values are different. I don't believe that. I do believe that the drugs and the availability of what they're seeing is different, and I think the addictiveness of these medications is what we really need to focus on. But I wanted to talk a little bit about bringing awareness, and through this program, some of the providers that we have attending thus far, the Victim Resource Center in Carbon County will be attending, the Carbon Monroe Pike MHMR. They also do the
your county's a joiner, I guess, for human services.
Yeah, our human services. Yeah, it's done through a joiner system between Carbon County, Monroe County, and Pike County, and that helps the counties to pool together their resources to provide more opportunities. We'll also have our district magistrates who will be involved, and we have those people on the front lines that are seeing these cases come before them on a daily basis, and they brought a lot to the discussion in our district as to how to address these issues. We also have several of our school districts are going to be involved, and our mayor's association they've sent out representatives. So I think it's a community effort, and House Bill 317 will complement what the community's doing in trying to get these the availability of some of these drugs off our street.
And you mentioned earlier, Doyle, about the heroin problem. I mean, I've got it in Bucks County. I mean, I know you're experiencing up in the area where you live, and many other parts of the state. And the heroin problem stems from the prescription drug problem, because people have to understand that these young people get hooked on prescription drugs, and when they can't get them or they get too expensive, they move over to heroin because it's much cheaper, and I guess the high is a lot greater, and it's easy to get. I mean, there's heroin all over the place, but the heroin problem is because of this prescription drug problem in the state.
Yeah, and that was obviously that's one of the issues that we want to stress. Is I know we're seeing a lot more of that, and then along with when you start having these addiction issues in the community, and at heroin, we're seeing more break-ins and petty crimes and thefts, and it's just one feeds on the other. And I think to go after the root of it and try to control these prescription drugs. I mean, right now, and maybe you can enlighten our audience a little bit. The time that it takes for somebody to clear up some of these addiction issues, if somebody does fall victim, and sometimes it's not always by their own demise. You have there's several cases of middle-aged men that have had back surgery and wound up getting addicted to these prescription drugs, or senior citizens who've had surgery or some kind of pain treatment. And but if somebody falls into that with an addiction issue to say an opiate based, what is this cycle? I mean, I've heard sometimes a year to 2 years to a lifetime to break that addiction.
Well, I think an important point to make is there is hope for these people because treatment works, and treatment is highly successful if you get the right treatment for the proper length of time. And you mentioned what's the right amount of time. And of course, that decision should be made by a medical expert in the field or your treatment centers. But I think the rule of thumb is that, you cannot get clean from these drugs with 3 or 5 or 7 days. I mean, I think a minimal amount of time is 30 days. And if you can get a longer amount of time, and I know we have insurance and how you're going to pay for it and who's going to pay, I mean, that's a big issue. But the longer length of stay that you can get in treatment and then maybe outpatient after the residential rehab, the better chance you have to kick the habit. And I'll also tell you another really good point. Once you get done with your treatment and outpatient treatment, going to meetings is really, really important. You'll really give yourself a much better chance of kicking it if you frequently attend meetings. And I know some people, very good friends of mine, go to meetings and they've been clean and sober for years and they still go to a meeting every day, or they go to 4 or 5 meetings a week. So going to meetings, AA meetings, is really, really important as far as, if you want to stay clean after you've gone through treatment.
And one of the issues that people have brought to my attention is people that do have insurance, or whether it be on medical assistance or through the state. There was legislation passed in prior sessions before I was elected to this body that was to address those issues. And maybe you could just explain a little bit about that legislation and what it had meant for the...
Chad, great question. And I believe she's going to be up at your expo, Deb Beck. Mm-hmm. She has been an advocate for drug and alcohol treatment up here in Harrisburg for about 30-some years, I believe, or a little bit more. She is the person that got our drug and alcohol insurance law passed here in Pennsylvania. I believe originally it was in 1989, and it's called Act 106. And everybody in the treatment field is familiar with Act 106. And what Act 106 basically says, that if you've got a group health insurance policy here in the state of Pennsylvania, that you are entitled to, by law, a certain number of days for detox and then 30 days of residential rehab per year. So, and it's by a physician's prescription. Mm-hmm. So the insurance company cannot dictate how much treatment you get. If you go to a doctor or a treatment center and their doctor says that you need 30 days of residential rehab, the insurance companies have to pay for this. And it's an important message to get out to your constituents and all across Pennsylvania, because we have a great drug and alcohol treatment law here in Pennsylvania. It's the best of any of the states. But a lot of times, if you call your 800 number on your insurance card and talk to the insurance companies, there's times that they might, not quite lead you in the right direction. Mm-hmm. But as long as you're going to a doctor or psychiatrist or somebody, a medical professional at a treatment center, they know all about this insurance law. You are covered here in Pennsylvania, and we do have a really, really good drug and alcohol insurance law.
And I think that's one of the important things, is to bring that awareness. I'm sure that a lot of folks that may be viewing our program today, or maybe dealing with some of these issues, may not be sure or may not want to reach out and make that call to find out about those services.
Yep.
And if they're not sure, they can certainly contact our legislative offices or those agencies that deal with that to assist them. And I think the insurance companies, they have a responsibility to pay that, and I think it's just a matter of getting that information out there.
And the insurance companies know that is the law. But again, if you have trouble, up in your area, I mean, I'll certainly call you and you can direct them and make sure that they're getting the proper treatment that they deserve and are paid for, really, because they're paying for the benefit. Yep. And you talked about medical assistance also, or Medicaid, and people that are qualified for that. So I mean, if you qualify for Medicaid, which is medical assistance, I mean, that opens an awful lot of doors up for you as far as treatment, whether it be for drug and alcohol or mental illness. I mean, it opens a lot of doors for you.
And I would have to say that those investment dollars that are made in treatment, whether they be through MA or through the insurance, or through the savings in the long run, it's money that's well spent to assist people to get back on their feet. Well, Gene, thank you. And we're going to take a quick break here, and then we'll be right back with the legislative report.
Okay.
Did you know that Violet Oakley was the first female artist to receive a large commission for artwork done in a United States Capitol building? In 1902, Joseph Houston, designer and architect for the 3rd Harrisburg Capitol building, commissioned Violet Oakley to paint murals for the governor's reception room. He believed that Oakley's contribution would add interest to the building and act as an encouragement of women of the state. Prior to beginning her work for the Capitol, Oakley set out to England to conduct research for her murals. Upon return, she decided to center her artwork on William Penn and the founding of Pennsylvania. Oakley made sure that Penn's ideals of justice and peace could be seen throughout her work. In 1906, she completed 13 murals titled The Founding of the State of Liberty Spiritual and was placed in sequential order around the governor's reception room. These murals were some of the first to be installed in the Capitol. When Edwin Austin Abbey, another artist for the Capitol, died in 1911, Oakley was offered another opportunity to create murals for the unfinished Senate and Supreme Court chambers. Her work on the Senate murals, including International Understanding, was completed by 1919. Oakley then completed the Supreme Court murals, including the Divine Law, by 1927. Oakley is said to be the principal artist for the Capitol, with a total of 43 murals on display. She remains one of the greatest muralists in the United States. Now you know.
Pennsylvania's drug-related deaths rank higher than the national average. In fact, more than 1,800 residents of Pennsylvania died as a direct consequence of drug use. That's more than those that died from car accidents and firearms. In Carbon County alone, there has been a sharp increase in drug overdose-related deaths. In 2007, 4 adults died of drug overdoses in our county. That figure spiked significantly in 2010, when 18 county residents, including 1 person under the age of 21, died of drug overdoses. It's important that parents, educators, and community leaders in Carbon County and throughout the entire state keep talking to kids about the harmful effects of drugs and alcohol, and to educate themselves on these facts. I am hosting a free Carbon County Drug and Alcohol Awareness Expo on Thursday, April 18th from 6 p.m. to 8 p.m. at the Lehighton Area High School for parents and educators to gather more information on substance abuse. This type of event brings the community together to hold a discussion with regional and state experts regarding current events, news, and topics related to drug and alcohol awareness and prevention. Together we can set the message straight with the youth across our county about the harmful and sometimes fatal effects caused by drug and alcohol abuse. I hope to see you there. Welcome back to the program. Today I'm discussing the work of the House Human Service Committee with Chairman Gene DiGirolamo. Gene,
Doyle.
Thanks. Thanks again for being here. Now you have been a champion of these issues for many years here in the State House. If you would like to just give an overview, in the session prior to me becoming elected, there was legislation that was passed to set up a Secretary of drug and alcohol in the governor's administration. So if you could talk a little bit about that and what the opportunities are with that new department.
You know, Doyle, and people ask me a lot of times, why do I have such a passion about, you know, the drug and alcohol issue? And I've been very open about this, and I've shared this with you. As a number of years ago, I had my oldest boy, Gene, who had a drug problem. He was a heroin addict. And so I know what it's like for a family and for an addict to go through that addiction. It's just a terrible, terrible experience. Now, I'm very fortunate. My son got into treatment. He got into the right treatment, and he has been now, I believe, 14 years clean and sober. And I like to look at treatment and recovery as kind of like a miracle. So that's why I have a real passion for this, because I understand what families go through. And you know, it's just a terrible, I think it's the #1 problem that we have in society. And you talked about the criminal justice system and your DJs. We estimate that probably better than 3 out of 4 people that are incarcerated in Pennsylvania, whether in the state prison system or the county prison system, are there because of a drug and alcohol problem. So I really think it was a priority that we need to do something about. That's why I was the prime sponsor of a bill that created a Department of Drug and Alcohol Programs. Now, that's a cabinet level position, much like you have a Department of Transportation or you have a Department of Health. We now have a Department of Drug and Alcohol Programs, and we have a secretary, who I believe you know very well. His name is Gary Tennis. He's the first secretary. We got the bill passed at the end of the Rendell administration, and he signed it into law. And Governor Corbett got to appoint the first secretary, which is Gary Tennis, and he did that last year in his first year in office. And the new department is up and running, and I think it's going to make a big difference in the way we look and fight drug and alcohol abuse here in Pennsylvania. We didn't reinvent the wheel with this new. I mean, we didn't create a whole new bureaucracy. We actually just moved a bureau of drug and alcohol programs, which was in health, and we made that the new department. Now, the new secretary is in the process of moving some of the other pieces that deal with drug and alcohol, intervention, prevention, trying to coordinate that all into the new department, and I think that's a really good thing. Licensure also. So we have a secretary, and why do I think it's important? I think it's important because when the governor's sitting in the room with all the secretaries and they're talking about legislation or they're talking about budget issues, I mean, you've got a person sitting in the room with the governor and the other secretaries that'll be able to take this cause up. And that's why I thought it was really important to get done. And I think it's having a big impact. Gary Tennis is doing a terrific job. He's got a deputy secretary. Her name is Kim Bowman, and she is really just wonderful when it comes to understanding addiction and working with all of our counties across Pennsylvania, making sure that they have the proper funds and the ability to serve constituents if they have addiction problems.
Well, thank you, and I think it's important that that the viewers realize that so often they label Harrisburg as detached, but I mean, as you tell your story, and I know some of the families in my district have told me their stories. These are touching stories. These are real people, and these are real issues. Yep. You look at the impact in the family as they deal with these issues, and wanting to give them that support. I think step 1 is to try to get the availability of these drugs off the streets. Step 2 is through awareness to the problem, and then if there is an issue to get the treatment that's needed, and then also continuing to work here in Harrisburg to provide our opportunities for our counties to address these issues. When you look at the money that we spend in our prison system, and I know as you stated, approximately 3 out of 4 are drug related, and I think back, and I think most people can reflect personally on their personal experiences with family members or friends involved in the prison system, and a lot of it goes back to drugs or alcohol addiction. Yeah. So the money that's spent on these programs for treatment is well worth it.
You know, it costs almost $100 a day to keep a person in prison today in Pennsylvania. I mean, it's over $30,000 a year. I mean, we like to say, they say in the drug and alcohol field, that for every public dollar that you put into treatment, you save between $7 and $10 somewhere else along the way. Because if these people don't get help, Doyle, you can see it up in Carbon County. I mean, they're going to end up in the emergency room. at our hospitals, and the hospitals are going to treat them with uncompensated care. They're going to end up in the criminal justice system, as we've just been talking about, or unfortunately, they're going to end up dead. And drug overdoses right now in the state of Pennsylvania outnumber the number of traffic accidents and the number of deaths by gun violence combined right now in Pennsylvania, drug overdoses.
And that goes to speak to the fact of the epidemic that we're having right now. And I think it's important that we continue to push and bring awareness to this. So often, people we have put airbags in cars, and everybody wears a seatbelt. But this is another issue that we need to deal with in that same focus. And I believe that if we focus on that issue and push it as we have been here, that we can make some strides in the right direction. But there's always going to be the new drug or the new fad that's out there. In the past, we passed legislation to outlaw bath salts, which were becoming an issue. As we continue to address it, but I think the issues need to continue to be addressed on the streets and in the home with families and through awareness to providing our families the tools that they need to combat.
That's what you're doing with the seminar you're holding. I think that's just a terrific idea. Parents really got to be aware of the problems out there. You got to keep an eye on your kids, boy. I'll tell you. Yeah. There's a lot of dangers out there.
It's kids and it's adults, and it goes through with the prescription drugs that we had spoken in the first part of the program. How that's such a gateway. When they can't get those prescription drugs, they turn to possibly turn to street heroin, and it just feeds on itself. So bringing that awareness and for anybody that would have an addiction issue or feels that they may have an addiction, to talk to their physician, to talk to their doctor, to seek treatment right away, and get that early intervention.
Yep. And we have these bills, and I think the bill will come to our committee about maybe decriminalizing, legalizing, or the idea of medical marijuana here in the state of Pennsylvania. And I just continue to think that's not a good idea. I mean, marijuana is a dangerous drug. It's a gateway drug, and I think if you talk to almost any addict, a lot of the addicts anyway, they'll talk about starting out with drugs like marijuana at the very beginning. And we also got to talk about alcohol too, because alcohol by far is still the #1 abused drug in our state and across the country.
I think when they look at legalizing or marijuana, we really send mixed signals to our children. Yep. On the one hand, we're spending a lot of money and resources in early childhood education and programs throughout the school to discourage our youth from getting into drugs. And on the other hand, you have folks talking about legalizing these substances, and it really creates it sends mixed signals. And
I agree.
I think we need to be solid on what our approach is. And I think if you also look at the cost of that drug addiction when it comes to workforce and employers. I mean, certainly you don't want that person who's abusing drugs or high, changing the tires on your car, or putting new brake lining on your car, or making the food at the restaurant. They could you wind up getting sick from salmonella. So people need to also realize that this affects our workforce too and our employers. And I think it's a good message to send out to our youth to be united and send in the same message to stay away from drugs.
Right. Drug, just like the DARE program says, just say no, stay away.
Yep. Well, Chairman, I thank you for your time today.
It's been a pleasure, Doyle. Thank you for your good work on the committee too. I mean, you're just doing the committee meeting the other day, you spoke up. I mean, that was just tremendous. So thank you for the good work that you're doing on our committee.
Well, thank you, Chairman. I appreciate your time.
Yep.
That's all the time we have for today's program. I'm State Representative Doyle Heffley. If you need assistance with any state government matter, feel free to contact me at my local office or through my website. That information will be shown in a moment. Thanks for watching, and please join me next time for a legislative report.